because all the evidence shows Maitland. We can use the McKinsey's also, and we can use the other techniques. But Maitland will be much more effective. Very good. Then give a traction and give an internal and external rotation. I'm sorry, it was not McKinsey's. You can use for Mulligan's peripheral joint mobilization. That also you can go for. Maitland's will be more comfortable for the patient because Mulligan's will be a grade 5 rather than grade 4, and because Maitland's usually start from grade 2 and grade 3. The patient will be comfortable. You can see the external rotation is not that painful for this patient right now. Right, followed by a capsular stretch. On this. Okay, right. And you can go for a gliding. You feel like gliding as well. And you can always go for the free range of motions when you finish down your mobilization. You have to be it's very important that you have to go for a free range of motions when you finish down with your oscillatory techniques. Right. So that is the main thing which you have to do. Always give a traction for this patient because the traction pull will be very effective. Right. Now, cyclical. Right. Now we can teach him the Codman spendular, and we can give assisted exercises, active assisted exercises. Like what I usually do is we can ask the patient to do. Yes. So so this is the comfortable level. So this is what you do with the patient. You can either use a pulley or you can use the van technique. Right. So both ways it is good. So this is eliminating, so the patient will not have any. Then you can go for അതുപോലെ ഇങ്ങനെ പിടിച്ചിട്ട് മെല്ലെ 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 കൈ ശരിക്കും വെച്ചിട്ട് കേട്ടോ, തല ശരിക്കും വെക്കുക. You have to always place a hand on the scapula because otherwise it will go for reverse scapular humeral rhythm, which is again in turn bad for the patient because muscle guarding response will be there. So that is all for the exercise part and for the stretching and for the mobilization part. Now, after all, what we have to do is we have to go for an ultrasound therapy which will heal the torn muscles. You can see micro tears will be there because we have stretched it basically. So what we're going to do is an ultrasound therapy as a phonophorosis. Again, we have taken an informed consent from the patient before doing the mobilizations and before doing the ultrasounds, because it is always very, very important, and we have always adhered to the principles like going for the indications and contraindications and precautions to the patient. This patient is absolutely clear for ultrasound. There is no contraindications, and there is only a partial contraindication. It's not a partial, you can say it's a precaution because it's hypertensive. So what I suggest is, I'm going to use an ultrasound in which I will be using for basically a phonophorosis, right, for this patient. And so what I'm using is a local anesthetic lidocaine spray. Then I will spray converted water. I spray to the part, especially all over the area, right, and switch on the ultrasound machine, and I'll go for, since this is more than 6 months, I'll go for usually chronic condition, and I'm going for head warming, so that this exactly the warming will go inside and clear out, improve the circulation, and it can clear and it can heal, right. And I'm going to keep a 0.3 to 0.5 until the 0.5, because my sole purpose is to heal rather than to alleviate any symptom, rather than to reduce the pain, because I've already told him to go for a hot formulation and to do the technique in his home so that he can have a pain relief. So, going for a circular. പക്ഷെ എന്തായാലും അത് ഇത്ര ഇംപ്രൂവ്മെന്റ് ആയില്ലേ. Okay. So this way we are going to. This is only the second day we are treating this patient, and preferably usually the first day after doing this the treatment, he had a mild improvement in the range of motion, and he had a, since I've given the grade 3 and the stretch, he had a bit improvement in the range of motion of 5 to 10 degrees, which is temporary because you have to maintain it. So I would rather suggest him a taping for maintenance, because again, for without going for the muscle guarding. But since he is a bit diabetic, we are not we don't know whether he is allergic to the tape. So I would rather suggest he will go like this, and after 3 or 4 days we might do a taping, which will be helpful for him to do his functional activities without any muscle guarding response. So, thank you.
Okay.
Thank you, and that's the short and brief conclusion of this patient, of this case. This is a purely an adhesive capsulated epilepsy case, and we'll be treating it for another 4 or 5 days, or maybe up to 7 days. And again, we'll be taking a SPADI score, and according to SPADI score, we will progress this case. Thank you.